Good morning, everybody. As Roger says, I'm Andy French. I'm the Charities Policy Public Affairs Manager. I'm going to talk to you this morning about this report which we've just published, and we've got some copies on the side, which we've called Unique Amongst Cancers. So just a little bit of a preface. So I joined the charity about 2 years ago. I've got about 20 years public policy experience, various government departments, charity sector, also Parliament. But I came into this role kind of really kind of enthused, but also really pleased about the opportunity to try and improve things for people. There's obviously some really the NHS is obviously a really good organisation, making tremendous progress, but on the other hand, there's some fundamental kind of issues in terms of what it's not always doing right. So here's so this is the kind of report which we're going to talk about. And so what I'm going to just briefly run through this morning is the evidence that we've been accumulating to date before this report, what we've done in terms of our early diagnosis programme, then the review itself in terms of why we did it, what we found, what we're actually now calling for, and then let's say our next steps in terms of early diagnosis. So the kind of key pieces of work that the charity had done was we've done actually now 3 national sarcoma surveys, which is kind of what we'd call quantitative. So this is basically where you accumulate kind of understanding against kind of questions about how many people are saying things are like this and how many people are saying like that. So how many people have had a diagnosis quickly enough, or they haven't had adequate mental health support, whatever that is. Also, we've done a report in 2019, the Late Cancer, and also delays cost lives. So the persistent issues in terms of these particular kind of reports that were being highlighted was that basically people are getting delays in accurate diagnosis after first consulting a healthcare professional. Referral pathways aren't always fully working properly, so not everyone's being referred to a specialist sarcoma centre, and that's obviously impacting then the prognosis and people's chance of survival. In terms of what the charity did, early diagnosis was taken on as a kind of key priority during our kind of current strategy period 2021 to 26, and as well as there was a kind of informed by evidence that we've been accumulating and input from supporters and healthcare professionals. And the report we did, Delays Cost Lives, sorry about that. Basically, there were kind of 3 kind of main focuses around that. The need for a sarcoma education program for healthcare professionals, to raise public awareness, and also to ensure that the pathways work properly. So that was what the charity called for. And then it also decided, well, actually, we can do some work as well, and we can try and make progress. So it set up an early diagnosis program supported by a steering group of healthcare professionals, people affected by sarcoma. Again, with those kind of 3 kind of main areas, and we also included some early diagnosis research. So in terms, just going to quickly run through those. So in terms of the education area, the charity has made lots of progress, and it's developed lots of really great modules. Gateway C, which is a kind of teaching tool for primary care, people in primary care, GPs. We also developed a really good physiotherapy module, obviously for physiotherapists with Nottingham University. We promoted it in the membership magazine of the kind of Chartered Society of Physiotherapists, and that got to about 80% of about 60,000 either training or in practice kind of physiotherapists. Also on the other side here, we've got the kind of the education animation for medical students, because we know that medical students often don't get very good good education around sarcoma in medical schools. And also then recently, my great colleague Sam Hackett has been taking forward work in terms of healthcare professional engagement, so kind of outreach and education, teaching people and so on. Another kind of key project which we've been funding for a number of years, is actually 12 years now, I understand, is the National Sarcoma Awareness Project. So this is joint funded with the BCRT, Branch Cancer Research Trust, because again, medical students get limited education. It's aimed at educating final year medical students and resident doctors about sarcoma. And it's kind of obviously educators and supported a lot of people to improve their understanding. Other kind of key work that we've done in around kind of public awareness is obviously we've done really kind of developed some really great online information resources, social media campaigns, works around kind of understanding kind of what sarcoma is, looking for the signs and so on, and also measuring and tracking a lump kind of resource. And here's some kind of images from that. So basically, to help people to become empowered know what to look for, to go back to their GP when they should do. And in addition to that, obviously we're engaged in the kind of annual July Sarcoma Awareness Month. So here's some images from our last two kind of campaigns. One on, the size matter and when you should actually go to your GP and get checked out. Another one last year about the kind of Don't Delays campaign, which is basically asking people to hold up how long did it take them to get a kind of diagnosis from when they first went to see their GP. So we've been doing all this kind of really great work. And we feel we've been making some really good progress. But and some of the other work which we've been doing, including on referral pathways, which I'm just showing here, this is kind of really kind of showing that actually there's much more progress needs to be made, probably across the board. And obviously we're making some really great interventions, but we probably need a much more systemic approach. So this is actually some work that we funded under a project called the Bright Star Audit by the hospital in Birmingham, analysed data from 12 centres, 163 patients. And the dark blue kind of colour in terms of the kind of different stages in terms of when people's cancer diagnosis was caught, basically is the period from when you go from presentation to referral. So there's a really, really big delay. But once people get past that stage, they're likely to get a much quicker diagnosis. But this is kind of really kind of fundamentally showing where there's a real fundamental kind of issue which needs to be addressed. But this kind of research is really, really important for us to understand actually what's really happening. And some of the other work that we've been kind of funding and supporting, we hopefully will have a report out soon based upon data from West Yorkshire, analysed by York University. But it's at the moment, what it initially indicates that there's a clear financial cost to the NHS, and obviously to the person as well, but a late diagnosis of sarcomas. So obviously that's not it's a great kind of outcome, obviously either for people with the condition, obviously, or for the NHS. And also we've funded some work at Sussex, Brighton, radiology-led diagnostic model. And that basically showed that there was a large number of referrals, but basically to people with benign lipomas. So lots of people getting into the system being referred onwards because GPs and so on don't understand what actually they're looking at, unfortunately. Also, lots of unnecessary delays because basically there's problems around the imaging. And not surprisingly, the kind of in this particular case, they funded a role for a CNS and a kind of navigator person, and actually had a really good benefit for the kind of individual, for patients going through the pathway. We've also been doing some funding, some joint work with BCRT to support scientific and clinical research, basically to look at to drive positive change around how sarcomas are detected and diagnosed. So that's all fantastic work, and the charity's been making some tremendous progress. But what we're kind of really conscious of, and my CEO Richard, if he doesn't mind me mentioning, we're just really conscious that we need to look at this across the board in a really systemic way. So this is why we kicked off this piece of work called State and Nation Review. So our view is that cancer has been prioritised by the four governments and NHS. They're making relatively good progress for some of the bigger cancers, but for sarcoma, the needs of people are basically being, to a large extent, policy and the NHS is kind of overlooking people's needs often. So the evidence which are kind of referenced to delays cancer, delays cost lives, our national surveys, work from our early diagnosis programme. It's unfortunately showing that the persistent issues. Also, our support line, which is obviously, as I've mentioned, cited some stats there, it's heard from an awful lot of people over the years. It also gets direct referral from the NHS, from specialist centres. So, and it's hearing about persistent issues which kind of really aren't showing the kind of the NHS working in the most effective way for people, especially around the kind of pathways and the diagnosis stage. So the purpose of the review was basically to look across the board, kind of really with a focus upon making sure that people get diagnosed earlier, have a better experience, live longer, obviously get a better overall outcome, get an up-to-date picture about health policy, how the NHS is kind of responding to people affected by sarcoma. And we were going to do it across the board in terms of England, Scotland, Wales, Northern Ireland, look at policy, having some commissions, and all the way across the board in terms of healthcare, primary to secondary care, specialist services, diagnosis pathways, research, and so on. And so that's what we've done over the last year. And we put it together with an advisory group, and we were very concerned to make sure that it was kind of democratic. So we made sure it was half and half in terms of people affected by sarcoma and healthcare professionals. Again, all 4 countries. We had the chair, Professor Anand Desai, he's the president of the British Sarcoma Group. He's a surgeon at Birmingham. We also worked with a consortium called True North Advisors. And we had Dr. Ellie Whitehead, who is a former MP at House of Commons, and Andrew Liddell, who's a journalist. Also, he's been a special advisor in government as well. Andrew actually came to us and he applied through the Involvement Network. He's on the Involvement Network. We put the advert out to recruit somebody for the role. He then kind of came forward with a really good proposal, but also Andrew himself has also had a sarcoma diagnosis, which I know you won't mind me mentioning. So very much we've tried to approach it as the point of actually including people, and actually to be driven by people as, you know, as much by kind of affected by sarcoma as much as by healthcare professionals. And essentially what we did, we worked with the advisory group, we met with them regularly, we put together a questionnaire, and that's people affected by sarcoma, which is really looking at the detail about people's experiences, and we also did a call for evidence. So all the other stakeholders, healthcare professionals, government, NHS, researchers, charities. And then we did some follow-up interviews, and we also backed it up with some published data and our understanding about how things are looking in terms of how things are supposed to be run and what's the kind of good policy pronouncements of government and so on. So what we were really looking for was where the NHS is doing well, good practice, where it needs to improve and how. And we received a really good response, over 300 in terms of the questionnaires for people affected by sarcoma, all 4 countries, over 60 call for evidence responses, 3 government departments, not the Welsh Government, unfortunately, but the UK Government, Scottish Government, Northern Ireland Executive. And we were really, really pleased with the response. We got some really rich detail about people's experiences at each particular stage, and we got some really fantastic insights from healthcare professionals as well. So the key findings, and I'm only going to touch. This is going to touch across. This is kind of a very broad kind of overview. So one of the key messages which we found that people, once they kind of get to a specialist centre, they're telling us that they get a really good response. They feel like they're looked after. They really value the kind of care they're receiving, and they actually feel like they're being listened to. So they're getting a really good response at that stage. But there's lots of other kind of areas where there's inequalities in people's over experience. So delays in diagnosis, referral pathways don't always work. There's inequalities in access. So there's travel, or if you live in a rural area, if you've got kind of, you know, if you've got a young family and you're having to try and get to appointments and you're having to travel lots, if you're on a low income, lots of kind of difficulties there. Obviously, also you have specialist centres, so that embeds, because you have a limited number, that's obviously kind of creates some challenges, but also, obviously, people want to be able to get to a specialist centre to get the best care. Over-reliance on surgery, old treatments, and research funding kind of lagging behind other cancers. So hardly anything coming through, lack of access to clinical trials. This probably isn't kind of particularly news to many people. And also some of the other areas, mental health support being inadequate, not being joined up, palliative end-of-life care, not being joined up either. And the one that doesn't sound particularly interesting, but it's probably fundamental to all this, the data reporting, the collection around cases, isn't being consistent. It isn't joined up. So those are the kind of broad findings which we had. Then just looking in detail at kind of 3 of those areas, diagnosis, pathways, and data. So I hope you can see that. So the kind of statements at the top in black, these are basically some of the kind of points in terms of what should be happening, or actually what's happening in terms of the factual evidence, as it were. So our latest survey, which we've got the results for 2025, 1 in 3 sarcoma patients wait over 6 months from first visiting their healthcare professionals to get a diagnosis, and female patients probably likely to wait over a year. Cancer waiting times, targets. So these are the things that are actually kind of there to try and speed on diagnosis from government. So there's a 62-day urgent referral to treatment standard across the board. England now has a 28-day faster diagnosis standard. 75% of patients' diagnosis is supposed to be confirmed and ruled out. It's actually just now gone up to 80% target. So just to kind of pull out some of the kind of key quotes, and I won't kind of read them out fully, but basically we've got a consultant oncologist in England saying there are different referral pathways from the different regions. Why does it have to be so different in different areas? Which is quite a kind of obvious kind of statement, really. Why is there such variation? Another consultant surgeon, many people have delays in the initial diagnosis. It's not because primary care doctors aren't aware of sarcoma, but basically they have limited access to urgent ultrasound or MRIs. And then a kind of GP from England, many sarcoma patients have a long route to getting a diagnosis, feeling no one's hearing them until they finally get a diagnosis. And then a CNS as well, saying, I have a lot of them, and they basically, this is kind of pulled out from detailed quote, but basically, there's beneath all that, obviously here in lots of cases, obviously there's a person, and obviously they've got their normal life, and obviously they kind of, they just basically want to get on with, everything. Pathways. So what should be happening is that all sarcoma patients should get a confirmed diagnosis from an MDT, multidisciplinary team at a specialist sarcoma centre. So what we heard was there is a significant minority of people, this is particularly people with GIST or gynecological sarcomas, they would find it really difficult to get a correct referral to a specialist centre. So there's quite here, gentleman, his brother wasn't told that he had a GIST, and repeatedly made to believe it wasn't serious, it was the best type of tumour to have, and he wasn't referred to a specialist centre. Another case where a female respondent about not getting a correct referral led to incorrect or inadequate treatment. So, their surgeon, the person saying the surgeon didn't really know what's about sarcoma, wasn't diagnosed until after they had the operation, then they were transferred on. They eventually got to a specialist centre, but basically the outcome wasn't the best. So obviously they've kind of had diagnosis after operation, not treated at a specialist centre. The surgeon didn't take the correct margins, led to multiple recurrence of the sarcoma. But we had obviously lots of these kind of cases that were highlighted by people, but also we had, again, people saying that once they got to a sarcoma centre, they felt they had a really good experience. And this particular respondent, this female patient, saying, my follow-up treatment by the NHS was outstanding. Doctors and surgeons have been amazing.
Yes.
And then finally, just in terms of the final kind of report findings, I'm just going to highlight. So the four governments, they all say that data is really important. You need that for national, local commissioners, and these are nationally commissioned services from the centre, and for healthcare professionals to improve your kind of outcomes and to get pathways working properly. That's the purpose of the cancer waiting times. In England, we looked at the data that's actually been reported on. This is the staging data, so 1, 2, 3, 4 stages of cancer. Just over half were recorded properly in 2024. So that's obviously an awful lot of cases which are just there isn't proper data. So the NHS doesn't have a full idea about actually the kind of the group of people it's there to look after. So there's inconsistent data and reporting across the UK. So it's for England, it's highlighted there, but the CNS of Wales told us it's pathetic, really. We have to do our own database. They use an Excel spreadsheet. A CNS in Northern Ireland saying they need to improve data collection to ensure it's used effectively in planning and commissioning. And essentially, the implicate from what they told us, they reckoned it wasn't. And also from one of our kind of fellow charities saying it's currently impossible to make definite comparisons between sarcoma service and outcomes, as the data is not presented in a way to help you do that. NHS England has a target for 75% of cancers to be diagnosed at stage 1 or 2, but they reckon it's nothing more than a fantasy when the data's really not very good. So, pulling all this evidence together, and that's kind of a very quick, brief overview, we've kind of basically looked at 8 kind of areas, and we've got 16 recommendations, which is an awful lot. And we thought actually this really needs a systemic approach. It needs government and the NHS to really take this seriously. So basically we've put together a kind of call to the UK government, the governments of Scotland, Wales, Northern Ireland, to urgently review everything, to review sarcoma services and properly look at the recommendations and implement them. So some of the things that we've kind of highlighted, and then I'll come back to what we're calling for in terms of data and pathways and diagnosis. So urgent investment in sarcoma-specific research and clinical trials, and we really desperately need a shared UK-wide research strategy. Health service workforce planning, basically, specialty centres need all the staff and skills that they need to be able to look after people. Mental health to be properly integrated with cancer care. Palliative care, end-of-life care needs to be kind of coordinated and joined up. And then for the health departments to actually report against the commitments, to actually work together with all their partners to actually plan things out properly. So those there's lots of other kind of detailing and recommendations, but there's some of the highlights. So in terms of what we were calling for in terms of early diagnosis, so essentially obviously people need to get a much faster diagnosis. Two main things here which we've called for: to establish an optimal diagnostic pathway for sarcoma. So they basically to get a pathway so that when you get referred on, it works properly. You get to where you should as soon as possible. You get a diagnosis as soon as possible. And for them to measure it against cancer waiting times, which government have set down. And then to make sure that there's kind of just really fast access to basically imaging and biopsies, backed up by proper expertise, by people who actually know what they're doing in terms of sarcoma. And then in terms of pathways, essentially, obviously, people should basically get through the system really quickly. So again, we've tied it to the kind of cancer waiting times. So by 2027, the full governments use the cancer waiting time data to basically really begin to measure things. And especially for people where kind of what we've kind of highlighted there, in terms of policy and government, they'll call this kind of health inequality. So this is basically unfair, systemic, unavoidable differences. This is what we're trying to really kind of look at, so that people don't face these particular challenges and inequalities, so that everybody gets a fair chance to kind of get treatment and to recover. And obviously this is kind of across the board, but particular ones we've highlighted there are around GIST and gynecological carcinoma sarcomas, because that was particular evidence that was highlighted to us. In terms of the optimal pathway, which I've mentioned, we've actually already started work on this. So we have an early diagnosis steering group, which I mentioned before, and the chair of the group, who's a clinician based in West Yorkshire, Rob Turner, he'd already been pushing for us to do this, and the group had already been beginning to kind of do some work and thinking around it. We were recently approached by NHS England, although it's going to be kind of done away with. Basically, it's the Department of Health. So they approached us and they said that basically we've been developing optimal pathways for other cancers. It's been really beneficial. We want to do one for sarcoma. Will you please take this on? So obviously we were kind of, yes, that would be great. This is what we really want to do. So it's basically the work's this is now beginning to kind of go forward. So basically to address late referrals, over referrals. So this is kind of cases where people basically have things like lipomas, they don't have sarcoma. Basically why there's, why the delays, and also why is the system not working properly? And then to make sure you get a system that actually pushes people through the system really quickly, and they're tracked and they're supported, and they're kind of able to get through to people who really know what they're doing in terms of sarcoma. So we're going to do this project over 12 months, and we're hoping we'll be able to kind of present the kind of the scope of it and the details at the British Sarcoma Group Conference in March. And then June next year, what we want to do is get this taken on. We work with the Sarcoma Advisory Group chairs, who are the kind of the cancer leads in terms of sarcoma around the country. So, and then hopefully if we get that embedded, we can then actually begin to get that as part of everyday management with this group of clinicians who lead and coordinate across the country. And then finally, in terms of what we were calling for in terms of data from the report, basically we want the database to be as good as possible, timely. So again, UK-wide standards, and then further to be basically to push for a UK-wide sarcoma audit. So the National Cancer Audit Model has been used for lots of other areas of other kind of cancers. It's been really beneficial, basically to get a really good data reporting system, really good standards, and so we get a really good picture of actually what's happening. I mean, in terms of data, one of the things is that, Sarcoma UK, BCRT, we've already been funding with, BCRT, work since 2018 to try and improve the data that's kind of collected, to give us an idea about actually what's happening, why the delays, why is the variation. So so some of this work can definitely happen. And this is actually, we're already bearing fruit from that. But what we want to do is really push to seek these improvements. So we launched the report about a week ago. We've had some initial responses from government. The Department of Health and Social Care for England, they basically said, they welcome it. Nobody should face delays or barriers just because, where you live or what type of cancer. Scotland, basically they're going to consider the findings from the report. And then Northern Ireland, basically, they've said yes, welcome the report, it's very helpful. I mean, the other thing is obviously in terms of what they've said is also they think that they're all to some extent doing okay. But I think we obviously need to kind of push and kind of really manage to get deliver change. So we launched the report House of Commons a week ago. We had a number of MPs there, and then Wes Street and the Health Secretary turned up, and we also in the middle there, Nikki Crowson, who's actually has been a patient. She's an architect by trade. She spoke, and also Anand Desai, who's on the right there, who's the chair of the British Sarcoma Group. He was also chair for this project as well. And then we also went to Stormont, Northern Ireland, and we had the Health Minister, who's holding the report in the middle. So, and we did that launch with the Boom Foundation, who we work with in Northern Ireland. And then tomorrow we're going to be in the Welsh Parliament, the Senate, doing a launch, and then we're also going to be going to the Scottish Government, which is this Scottish Parliament, which is the picture on the side here. So that's what we've done in terms of the reports. As I say, we've launched it. We're now trying to seek into influence and kind of get it kind of taken on by the different governments. Separate to this, I just thought I'd mention that, as you may have heard, since the current government came into office, they launched a kind of consultation on a 10-year plan. So we kind of fared responding to that. They also subsequently announced they were going to do a national cancer plan, which is lots of charities have been calling for years. And there used to be one. And basically, it's a kind of really, really important kind of step. We actually managed to get a place through Cancer 52, which is a coalition of cancer charities we work with, to be on one of the 6 working groups. So this is basically the government not only looking at all the evidence they received from people, but actually working with charities and different representatives to actually work up the detail. So they've got 6 groups. We're on the early diagnosis one. And basically, it's looking at things like screening and targeting people who are kind of particularly at risk, and timely presentation and primary care. And some of the things it's kind of really looking at in terms of the developing the recommendations to make them practical is about data around less common cancers, people's experiences and health inequalities. In other words, why is it unfair for some people compared to other people? And also research. So we expect a report to go to ministers next month or so, probably launched in the autumn. And then in terms of the larger plan, 10-year plan, which the government consulted on last year, probably in July. So that's probably going to have some money on it. The cancer plan won't, but hopefully some will come towards the cancer plan. Anyway, so that's basically drawing everything to a close. So on the report, I just say, we'd really encourage you to kind of contact your MP, whoever you elect your representative in whichever country, tell them to read the report and push for change. And we'll be kind of circulating something on that probably next week. And that was it.